Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.
Hello, I'm Dr. Paul Conley, and welcome to another episode of Doc Talk. Currently, we are here at the Lewis Center here in Oak Hill, West Virginia, in which a COVID booster clinic is ongoing. My special guest is Dr. Anita Stewart, the health officer here in Fayette County. So, Dr. Stewart, pleased to be with you again on this beautiful fall day. So, I wanted to talk to you a little bit. We just did our town hall. But since our town hall, new information has come out and there's some new guidance. So maybe you can talk to us a little bit about what the FDA just released as far as guidance with boosters, or some people would call it a series of 3 doses.
Yeah, so thank you for having me. So yes, just recently the FDA, CDC, and those groups have met to release a booster dose for the Pfizer-BioNTech product. And that is for specific groups. Those are anyone over the age of 65 or anyone in long-term care facilities, staff or residents. It's also for anyone age of 50 to 64 with high-risk medical conditions. Those 2 groups should be vaccinated. There's good evidence for that. And then there's also anyone that's 18 years of age to age 49 with medical conditions that put them at risk for COVID. They may be vaccinated, as well as any what we call essential frontline workers. So that includes teachers, healthcare providers, grocery store workers, people that work at gas stations, anyone that's highly exposed to the public. They would also are encouraged to consider having that vaccination boost dose. That would need to be 6 months after their original series.
So basically, again, so all these people that you just recommended, and these are people that received the Pfizer vaccination, and again, it should be 6 months. So, I had a patient ask me this question, and so I'm going to ask it to you. They had their series, okay, their 2-shot series, they're fully vaccinated. But, they were that very, very, very small percentage of people that had a breakthrough case. They had breakthrough COVID. And it's been past 6 months. And their question to me is, when do I get that 3rd dose, and how long should I wait to get that 3rd dose? Because by all means, I want to have additional protection.
So there's really good data right now that shows that if you have actually been infected and then become vaccinated with one of the mRNA products, that it actually really almost super boosts your immune system. I call them, they're like superhuman then after that. And so we're encouraging those folks to go ahead and get the booster as long as it's been 6 months since the completion of their primary series, so 6 months from their 2nd dose. They would be eligible even if they had COVID in the interim.
So I think, it's important, again, going back to the prime series, because I don't want people to lose sight of the fact that we're here at a booster clinic today, but there's a lot of folks that haven't received their first vaccine. And that's still the people that we're really trying to reach out to, because those are the ones that get COVID that don't do well. In fact, you're 11 times more likely to die from COVID-19 if you've not been vaccinated. So we really wanted to stress that. So, I think one of the things, speaking of people that have had the virus, I still get people asking me this question, Dr. Stewart. I had the virus. I have not received the vaccine. If I have some immunity after having the virus, do I still need to get a vaccine?
Yeah, and the answer to that is yes, because we do have data that it shows that you have even more protection. So I would encourage everyone, even if they've had COVID, to get the vaccine. It works very well at protecting our population.
Well, one of the things that I've seen is I have seen people that back in the winter, they had COVID and for whatever reason didn't get their vaccine, and they contracted this Delta variant, which is what we're seeing now, and they got COVID twice. And is that something that you've seen as well?
Yeah, that's something that we're seeing. I start recognizing names again that are coming through. We are seeing some of those reinfection cases. They're less often, but we are certainly seeing them. So, and those typically are folks that haven't been vaccinated in between, like you mentioned.
So I guess, one of the questions that's been posed to me are people that received Moderna or J&J. And so when the FDA came out last week, when the FDA came out with their guidance with the Pfizer vaccine about getting the third dose, and there's ongoing studies with Moderna and J&J, some of those folks are a little concerned about being left out, and what does that mean for them, and should they be concerned? So maybe you can talk a little bit about if you've received Moderna or J&J. Currently, you're not, unless you have some special circumstances like organ transplant or cancer patient or going chemotherapy. You're currently, we don't mix and match, right? You don't do Moderna, Pfizer, and are they protected? Or do you mix and match? Maybe we can clarify that.
Yeah, so those are all really great questions and great discussion points. So right now, Johnson & Johnson and Moderna have submitted data to the FDA and to the CDC for review to see, do they need booster doses? I do think that will be something that's coming, but right now, particularly for Moderna, it is very well protecting folks, even 6 months post-vaccine series, at preventing hospitalization and death. I think it's really important to remember that the goal of these vaccinations, just like influenza vaccination, is to prevent hospitalization and death. We're going to still see cases here and there, what they call these vaccine breakthrough cases. Those are mild illnesses. If you look at our data, and even in West Virginia and as well as locally, you're going to see that this is a pandemic currently that's being driven by unvaccinated individuals. And so, yes, everyone is looking forward to getting boosters, and but again, the most important thing, like you've already alluded to today, is that the folks that have not been vaccinated yet, that they do so. We still have quite a ways to go here locally and in West Virginia to get the coverage that we need.
I was, there's some graphs that we're going to put up here on the screen, because I have had some patients, and this information you can find at the DHHR website, correct?
Yes, it's the DHHR coronavirus website.
So if you go to that, you're going to see some graphs here that we're going to put up, and I want you folks to look at this. One of the things that you're going to see when we talk about these breakthrough cases, because I do think that unfortunately there's been a lot of attention to breakthrough, and some of the folks that have been reluctant to get a vaccine are like, see, you can still get COVID despite being vaccinated. But actually, when you look at the fully vaccinated individuals, it's like 1.34%. So it's not even 2% of fully vaccinated people contract COVID. That's super small. And then when you look at deaths, so if you're fully vaccinated and you look at the percentage of deaths we're seeing with that, it's like 0.016%. And when you look at that, to do the math, that's 1 in 10,000. So if you're fully vaccinated and you contract COVID, you have a 1 in 10,000 chance of dying. And statistically, I just looked at this before the show, you have a chance of dying in a motor vehicle accident, lifetime, which 1 in 103. So you have a much greater chance of dying in a car crash in a lifetime than you do of COVID if you're fully vaccinated. So I just want people to look at these graphs and kind of see these numbers. So again, we know that vaccines work, we know they're safe, and we know they're highly effective. And to your point, as far as where we are with hospitalizations, maybe you can tell us the numbers of when we see people on ventilators or we see people in the ICU, what's the percentage of that?
Yeah, so again, that's also on that website. You can see that these are largely occupied beds and vents by folks that are unvaccinated. What we do know is that the ones that are there that are vaccinated typically are over the age of 65 or have significant comorbidities and or immunocompromised. So these are people that we know have more risk to get sicker faster. But again, the predominant folks that we're seeing here locally are unvaccinated, and that rings true across the state.
And one of the things, too, that I know personally is some of the folks that I do know that were elderly or immune compromised that were vaccinated. When you contact trace, where do they get it from?
They got it from someone that's unvaccinated.
Unvaccinated. So again, it kind of goes back to the same storyline. And let's, if we kind of see what we're saying here, folks, is that it's a pandemic of the unvaccinated, and the unvaccinated folks, unfortunately, is what's continuing to drive the numbers. And so you take grandmother who's had her vaccine, she's got some health issues. Granddaughter comes in to visit her, she's unvaccinated, and grandma gets sick and ends up in the hospital. So in saying that, you know, if you do contract COVID, do we have a way that can help keep you out of the hospital? And if we do, vaccinated or not, if you contract COVID, what can one do to hopefully protect them from hospitalization, serious illness, or death?
Yeah, so now we have excellent treatments with monoclonal antibody therapies. They're available here locally, not only in Fayette County, but across the state. There's several sites that are offering them. And what we know is that given early in the course, within the first 10 days of illness, it can reduce the risk of hospitalization and death. And so last week when I checked the numbers, this is just at Plateau Medical Center here, we had given 277 monoclonal antibody infusions and only had 3 subsequent hospitalizations of those 277 people. I think that's pretty good. We haven't had any side effects with those infusions. It is an IV infusion. You can also get it subcutaneously. It's very well tolerated, and it provides, it's a passive immunization, so it provides immunity for about 3 months for folks, but also prevents hospitalization and death, which is ultimately our goal here.
So I think, again, the take-home point is that if you test positive for the virus, COVID-19 that is, if you test positive, you don't want to wait till you start having symptoms. This is a virus that's replicating within your body. And so the quicker you can get the monoclonals and stop that replication, by far the better you're going to do. And I think sometimes what happens is our people, they may be a little embarrassed. Oh, I didn't get my vaccine. I didn't, you know, I don't want to tell anybody, so I don't want to go to the hospital. Listen, we don't punish people for their choices. And if you choose to not get the vaccine and you get COVID, please come in early. Get the monoclonal antibodies. We have them here at Plateau. There's other centers around. I know at Summersville Regional Medical Center, they're giving them there, Braxton County, and whether it be IV or subcutaneously. And again, the statistics, you know, hold true that the folks that do get monoclonals most definitely dramatically reduces your risk of serious illness and death. You mentioned earlier about flu. Okay, we're in flu season now. And so, you know, earlier, you know, when we talked about getting COVID vaccine in combination with other vaccines, whether it be pneumonia vaccine or shingles vaccine, you know, we had kind of initially thought maybe you should wait a couple weeks, maybe in between shots, to give your body some time to like mount immunity to one vaccine and then another. But that's changed a little bit, right? So if it's flu season and you want to get your flu shot and you've decided to get your COVID vaccine, can you at the same time get those shots?
Absolutely, and we would certainly encourage that. We don't want anyone to delay vaccinations because that can certainly lead to consequences that are unhealthy for folks. So we just ask that they either be at different sites, so one in each arm, or that they're at least an inch apart, and folks are doing really well with that and tolerating that well, and it's available. So one trip to the pharmacy or to your healthcare provider, get them both done, protect yourself, and be safe for this flu and COVID season.
And the same thing with the pneumonia vaccine. So, you know,
Exactly.
again, you can come in, roll up both shirt sleeves, one shot in one shot in the other, come in and get your vaccine. So I think, you know, that has changed a little bit. So I want people to understand with flu season, you can come and get your flu vaccine. And you can, you know, if you're a Pfizer recipient or 6 months out, you can come here and get your booster. So we're getting ready to take a break, but I want to let people understand you want to stay tuned because Dr. Stewart has employed, she calls it the Retired Doctors Club. We're going to actually meet some of these retired physicians that have, some of them are semi-retired, so let's clarify that. But they are here helping out the community and continue to vaccinate. You folks are not going to miss this, so stay tuned, and we'll be right back.
Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.
Hello, welcome back to Doc Talk. I'm Dr. Paul Conley, and we are here at the Lewis Center at the COVID-19 booster clinic. My special guest is Dr. Anita Stewart. But at the break, I actually went indoors and actually was able to apprehend a couple other doctors that are part of this booster clinic. Furthest to my right is Dr. Millie Peterson, and next to her is Dr. Lewis Cook. And these folks have been instrumental in continuing to vaccinate, not only just at this clinic, but all the clinics that we've had. So Dr. Stewart, I think you have named these doctors that have helped us out, and Dr. Ackerberg and as well as Dr. Newell. They're indoors. They couldn't come out because you can see all the cars going by. They want to make sure they continue to get shots in arms. But Dr. Stewart, tell us a little bit about this semi-retired doctors club you have here with us.
Yeah, so when we initially were launching vaccinations in our community, we had quite large community events and we needed help. And so I reached out to my colleagues, and some are retired, some are semi-retired, but they understand the importance of vaccines and certainly have been instrumental. We have excellent partners here in this community, which I think helps, keep our community safe and healthy. So, I'd love to hear, your experience with the retired doctoring, vaccinating our community, and why you think it's important for us. Lewis, you want to go first?
Okay, well, actually, I very much enjoy doing this because I'm seeing so many people that I saw over the years, and it's just a reunion every time I see another one. Of course, it also allows me to do some contribution to community as part of their health issues, and obviously the importance of getting the vaccine into as many people as possible is so outstanding that it's just really rewarding.
Right. What about you, Dr. Peterson?
Well, I guess I believe in the vaccine. I think the vaccine is so important for our community. I also continue to work occasionally, and I'm alarmed by the amount of COVID that we continue to see, and we continue to see spikes. And I truly believe that vaccination is our way out of this. So whatever I can do to contribute to my community to help us all be healthy, I'm going to be there.
Thank you.
One of the questions I would have for you guys is, Dr. Stewart and I, we rotated through folks. Dr. Millie Peterson was actually my very first rotation back in the 90s. I'm not sure if I'm allowed to say that, but in the 90s. So obviously this is a pandemic that none of us have seen before, but you folks especially have been through different vaccine rollouts. I think about, the chickenpox vaccine, and there was maybe some hesitancy with that, and Gardasil with cervical cancer and things. So I guess, when we think about chickenpox vaccine, I think there was a time maybe you can, talk about there may be some hesitancy, and we talk about how we don't even think of chickenpox anymore. When I was a medical student, we saw sick kids with chickenpox, and now we don't. So maybe you first, Dr. Cook, and then you, Dr. Peterson. So tell me a little bit about why is this so important, and maybe for folks that still have some hesitancy out there, what is it that might be able to convince someone the importance and the safety of this vaccine?
Well, I have to disagree with you a little bit. I have never seen this much hesitancy in the public toward vaccine. I think the trust in the medical community and
hold that thought, Dr. Cook. Currently, we have a helicopter coming in, and what that means is this helicopter is a medical helicopter, and what this usually means is that it's a patient or an individual that we don't have a bed for, and very possibly it could be a patient that has COVID that we don't either have ICU bed or we don't have a ventilator for. So, this just happens that this happened right during the show, that we actually can see for ourselves that this is one thing that we're seeing with this pandemic, that, our healthcare system really truly is strained. And when we see a helicopter land here behind us, that means there's someone very, very sick here at our hospital that's needing to be sent to a higher level of care. And unfortunately, with the pandemic, we are having shortages of not only ICUs, beds, and also ventilators. I'm sorry, Dr. Cook. So back, you were saying you've not seen this much hesitancy in your entire career. So maybe you can tell us, what do you mean by that?
Well, I've just never seen the lack of trust in what experts are telling people about the need for vaccines and how it worked. And before it was, we always had some people that objected, but those numbers of people were so low that we could establish immunity in most of the community. And when we were able to do that, this so-called herd immunity took place, and it virtually wiped out these diseases because there were so few people that weren't vaccinated. It's a whole different world with this because we have much larger numbers of people that are refusing to do it. We're not able to get to the numbers that we need to be to establish across the community immunity, and now we're getting a lot of complications as a result of that, including the variants that are developing and which may develop in the future, and it's the difference in the community's approach to this and what has gone on in the past, I think, is demonstrable.
Well, I'm glad you brought that up because, again, he couldn't come out because he's continuing to see all the cars lined up here. Is Dr. Donald Newell, and he informed me he was the health officer for Fayette County for 35 years, and he has said the exact same thing, Dr. Cook. He actually said, people just don't trust. It's either the government or they don't trust science, and something that that he didn't deal with as well. When it came to chickenpox or MMR or other vaccines, to go to the school, say West Virginia, you have to be fully vaccinated, and there was always, like you said, a handful of people. But I just want people to understand that that this isn't a government issue. This isn't a political issue. This is a public health issue, and I think Dr. Stewart has said at the break, we need to take care of thy neighbor. And I think that's one of the things she had said, at the break. She says, please, get out there, Dr. Conley, that we need to take care of each other. It's not just about yourself, but it's about your neighbor, that person behind the counter, at the grocery store. This is someone that may have an illness that they were to contract COVID, may not do well, just, as this person that's, being flown out as we speak. So what about you, Dr. Pearson? I mean, how do you approach people that have some hesitancy, and how do you go about trying to make sure that we get as many people vaccinated as possible?
I think, we've been over a year dealing with all of this, and the thing that has most surprised me is this kind of new interaction that I occasionally have with people, in which I, as a physician, I care about them. I care about my community, and I am trying to make the most non-political decisions about health care that I possibly can. And I'm confronted with people whose information I just cannot, I can't rectify it with what I get in the scientific community and from other physicians, from doctors, etc. But the thing that bothers me the most right now is the fact that when I try to talk to people, I actually have had people who think we're now kind of labeled as bullies, that we're trying to bully people into getting vaccinated. We're trying to force people. Now, I do understand that the government has made whatever rules that they've made. Hopefully they've made them because they think it is in the best interest of public health. I agree that people, I don't want to force anybody to do anything. In the same fact, I don't want to force other people to be exposed. So it's a bit of a push and pull. But the thing I probably want to say the most to the public is we as healthcare workers are not bullies. We are not here to make you do. We're here because we care about the individual. We truly believe that the vaccine is so important. And where I work, to be honest with you, I'm on the front line of the COVID exposure. The number of people we're diagnosing is at kind of an certainly either at an all-time high or as high as it was initially. But the number of people that we're sending to the hospitals is increasing. This Delta virus is a potent virus, we'll call it. People are getting sick. If you have had the vaccine, and I'm not going to tell you that you won't get it's impossible for you to get COVID. But if you get COVID and you've been vaccinated, the chances of you being really ill, the chances of you being hospitalized, the chances of you being on a ventilator, the chances of you dying are drastically decreased. And I'm not saying this because some statistic, some government agent told me, anything like that. It's really what I am seeing on a daily, weekly, and monthly basis. So I hope that the people who are trying to encourage you to get this vaccine, that you don't just ignore them because you think they're a bully, because you think that they're not listening to you. Please hear them as people who are really trying to keep you healthy, trying to keep your loved ones healthy, trying to keep our community healthy. We're starting to see much more younger people diagnosed with COVID. We just, we as healthcare workers are here to keep you healthy. That's all I can say. And we want to listen to you. We are trying our best to hear everything and to consider all possibilities, but our information and our experience is that the vaccine works.
So again, thanks for you folks coming out this afternoon. I'll let you guys get back, to the important work that you're doing. I'm Dr. Paul Conley, and you've been watching Doc Talk. And until next time, be safe and have a good night.